Hi everyone, welcome to our channel once again. In this edition we are going to talk about anxiety disorder. Most people live with anxiety and depression which affects their day-to-day activities causing unnecessary fear, panic and mental health issues. There are several different anxiety disorders, which can present with different symptoms. We have separation anxiety disorder, phobia, panic and environmental anxiety. There are several ways to manage anxiety disorder to enable you live a healthy life. Stay tuned. Anxiety is a normal emotion. It's your brain's way of reacting to stress and alerting you of potential danger ahead. Everyone feels anxious now and then. For example, you may worry when faced with a problem at work, before taking a test, or before making an important decision. Occasional anxiety is okay. But anxiety disorders are different. They're a group of mental illnesses that cause constant and overwhelming anxiety and fear. The excessive anxiety can make you avoid work, school, family get-togethers, and other social situations that might trigger or worsen your symptoms. With treatment and good management, many people with anxiety disorders can manage their feelings. My husband, your attitude recently is really telling on me. What is bothering you? You get angry easily, you react to every little thing with shock and unaware. What is the problem? Please, my wife, I want to be left alone. I'm not in the mood to anyone right now. Please, I need to be alone. Why is your heart pounding and you are sweating as well? Please, I would like you to share your worries with me. I'm here to help you. I think you need to see your doctor as soon as possible. I notice you feel nervous. You often overreact when something triggers your emotions. You don't control your responses to situations anymore. I'm fine, nothing is wrong with me. I don't think it's necessary to see a doctor. I'm not sick, all I need is just time for me to figure out myself. I have so many things running in my mind. I don't really know what is wrong with me. I feel tired always. I feel restless. I hardly sleep at night. I think I need see my doctor. My wife was right. I have to work on my mental health seriously. Good morning, doctor. How is work going? I am here to see you concerning my health issues.
Good morning, Mr. Sebastian. Please make yourself comfortable. How may I help you?
Thank you, doctor. I'm having some unusual behavioral changes. I feel tired always. I breathe fast often even without having any exercise. I easily get angry and react over little issues ordinary I should have let go. I feel scared always and my wife is worried about that.
I'm so sorry about that, sir. Could you please tell me other symptoms you experience that are unusual to you?
Yes, doctor, I feel other symptoms like feeling panic, fear and uneasiness, nightmares, repeated thoughts or flashbacks of traumatic experiences, uncontrollable, obsessive thoughts. I find it difficult to get through the day or complete tasks.
Please tell me, are there areas in your life you are passing through stress or had times, because most people experience stress at different points in their lives. However, stress is a physiological response to a biological injury or a perceived threat, and it tends to be relatively short-term.
Yes, doctor, I'm passing through a lot of in my job, and I lost my loved one recently. A lot is running on my mind and it is really affecting my mental health.
What is disturbing you is generalized anxiety disorder. Patients with generalized anxiety disorder typically present with excessive anxiety about ordinary, day-to-day situations. The anxiety is intrusive, causes distress or functional impairment, and often encompasses multiple domains, example finances, work, health. The anxiety is often associated with physical symptoms, such as sleep disturbance, restlessness, muscle tension, gastrointestinal symptoms, and chronic headaches. Common symptoms are panic, fear, and uneasiness. Feelings of panic are not being able to stay calm, shortness of breath, breathing faster and more quickly than normal, hyperventilation, heart palpitations, dry mouth, nausea, tense muscles, dizziness, thinking about a problem over and over again and unable to stop, rumination, inability to concentrate intensely or obsessively avoiding feared objects are. Some causes of anxiety disorders are genetics. Anxiety disorders can run in families. Brain chemistry. Some research suggests anxiety disorders may be linked to faulty circuits in the brain that control fear and emotions. Environmental stress. This refers to stressful events you have seen or lived through. Life events often linked to anxiety disorders include childhood abuse and neglect, a death of a loved one, or being attacked or seeing violence. Drug withdrawal or misuse. Certain drugs may be used to hide or decrease certain anxiety symptoms. Anxiety disorder often goes hand in hand with alcohol and substance use. Medical conditions. Some heart, lung, and thyroid conditions can cause symptoms similar to anxiety disorders or make anxiety symptoms worse. It's important to get a full physical exam to rule out other medical conditions when talking to your doctor about anxiety.
Thank you, doctor, for your useful information and diagnosis. How can I manage anxiety disorder?
Learn about your disorder. The more you know, the better prepared you will be to manage symptoms and roadblocks along the way. Don't be afraid to ask your doctor any questions you might have. Remember, you are a key part of your health care team. Cut down on foods and drinks that have caffeine, such as coffee, tea, cola, energy drinks, and chocolate. Caffeine is a mood-altering drug, and it may make symptoms of anxiety disorders worse. Don't use alcohol and recreational street drugs. Substance abuse increases your risk of anxiety disorders. Eat right and exercise. Brisk aerobic exercises like jogging and biking help release brain chemicals that cut stress and improve your mood. Get better sleep. Sleep problems and anxiety disorder often go hand in hand. Make getting good rest a priority. Follow a relaxing bedtime routine. Talk to your doctor if you still have trouble sleeping. Learn to relax. Stress management is an important part of your anxiety disorder treatment plan. Things like meditation, or mindfulness, can help you unwind after a stressful day and may make your treatment work better. Keep a journal. Writing down your thoughts before the day is down may help you relax so you're not tossing and turning with anxious thoughts all night. Thinking positive thoughts instead of worrisome ones can help reduce anxiety. This can be challenging if you have certain types of anxiety, however. Cognitive behavioral therapy can teach you how to redirect your thoughts.
Thanks, doctor, for your time and information. I feel relieved now. I will stick to your instructions. I feel more relieved now. It's time for me to start up my normal day-to-day activities. I have to call my wife now and talk to her. Sometimes, a person can treat an anxiety disorder at home without clinical supervision. However, this may not be effective for severe or long-term anxiety disorders. There are several exercises and actions to help a person cope with milder, more focused, or shorter-term anxiety disorders, including stress management, relaxation techniques, maintaining support networks, physical exercise.